Pt.2 trained and certified informants in that community. We have a focal person in that community who collects information about diseases and transfer such information directly to DSNO at the local government level, who does the same thing by transferring the information to DSNO at the state level in the State Ministry of Health. But the information we got that sprung us to action was from a DPO, a police officer, which is a disorganized channel of information. But we didn't stop here. Even though it was a rumor, we went ahead and investigated.
Okay.
The result of our investigation shows that there is no strange disease in Kogi, there is no epidemics, and there's no, because we investigated everything possible, humanly possible.
Have you been able to isolate the cause of the gastroenteritis in this number of people?
That is what I have just said. To isolate it, you need to do culture. As I mentioned earlier, that one of the culture samples that we took yielded Klebsiella, which could be a contaminant.
Okay. Doctor, where I'm going is, if you have been able to do this, have you told the people what the cause is so that they can avoid whatever it is that they're eating?
We have actually gone further to test the sample of their water supply and the common foodstuff available in that community. We are awaiting the chemical analysis of those samples. But the human sample we took, we have the results, and there's nothing suggestive of disease of epidemic magnitude.
Okay. Dr. Audu, there's a statement that was credited to your ministry that talked about that of the number of about 62 people in the Yagba West local government area of the state. It says the current information available to us is that the disease actually started 6 weeks ago in Okoloke village in Yagba West, which is a settlement that is predominantly inhabited by Fulani herdsmen. Reported cases of deaths following abdominal pains, vomiting, and diarrhea. But the patients who showed signs of illness have since been evacuated and transported to Kogi State. Where are those patients now? Are they the same patients you're talking about, or are these a different set of people? Hello, Dr. Audu.
Hello?
Hello, can you hear me?
Oh dear.
Okay, Dr. Audu, I hope we'll be able to get back. We'll be able to get you back on the show. Let's come back to you. Dr. Akingbe, now, he's talked about them evacuating over 40 people, but a statement credited to him, which I asked him, about 62 people, vomiting, diarrhea, cases of diarrhea, vomiting, abdominal pains, and all that. What kind of conditions will cause that magnitude of abdominal pains in people and all of that?
Well, I'm not going to be talking about what Kogi is going through.
No, that's something.
But
conditions,
general conditions generally that could be, that could cause that is
cholera.
We're looking at cholera. We're suspecting cholera. What we did not get in the news is whether if they have actually taken the stool samples for laboratory analysis to have a concrete diagnosis of those people. And if it is like we have it, the number is a flash for us to be able to look at and take necessary action, looking at the environment generally, looking at the source of food, the source of water, the situation of the environment, which are likely to lead to contamination of food and what the people take that could lead to this condition. Yeah.
So you're thinking their water, their
Food,
refuse may not have been properly disposed and all of that?
Yeah, that is what we can suspect in this case.
I'm hoping that we can get him to come on, because that statement was credited to him and then he says something else. But you are here in Lagos.
Yeah.
This kind of environment you talked about, I mean, in the last few weeks it's been raining quite a lot. So you have waters collecting in different places.
Yes.
But we still have waste and refuse in some of these waters. How's that working out in terms of cleaning and
well,
the effect?
Giving it to Lagos State government, I will say what Lagos State is doing right now is trying to master the control of refuse. Because Lagos is, like we have on air, like you know, that Lagos is moving from a mega city to a smart city. You understand what I'm saying? And in the event there is a system already on ground. The existing system in Lagos State for refuse collection, for household refuse collection, go through the Pt.2 operators who will eventually, you know, approach the final dump site to take out refuse. All these are being phased out. And in a way to go into the next system of refuse management, which the Lagos State government termed CLI, Cleaner Lagos Initiative, it's an entirely different system entirely, where consortium of companies are brought into it to move refuse, and even Lagos State is doing a lot about that. It is the transition from this into the CLI that is what we see right now. And the local governments in the state and Lagos State government through the Ministry of Environment also are on 24 hours, you know, activities of moving refuse off the road. So
when you say some people have been brought in to help to clear up the refuse in the different neighborhoods, right? So case in point here, my neighbor has his refuse in front of his house, has not been removed, and he's made his payment in the bank. But according to him, the refuse collectors say it's not reflected in their books. But the neighbor says, I have made my payment.
The money never enter.
Okay, the money never entered their account. But he has made the payment in the bank. So his refuse has been standing there for over 2 weeks. So which is more important, clearing the refuse or the money? For the man who has shown you a teller, that look, I've made a payment.
I think the simple way to handle this is go to the regulatory office. We have the Environmental Services Department in the local government of the neighborhood they're talking about. You should, your friend should go there, make the report, and it will be, the issue will be handled. No, because we will not know.
Why I'm asking this question is, the question is, the companies have been brought in to clear the refuse. The Cleaner Lagos Initiative.
The Cleaner Lagos Initiative has not really gone into full-fledged operation, and they are not even collecting money. We are not paying to anybody for now. You are not paying to the companies brought in for now. They are still doing the test run and going to go into full-fledged by about September.
So if your people walk into that neighborhood now, that my neighbor could be arrested.
Well, we'll look at it. The responsibility of every individual is to make sure you bag your refuse. Have a very good, we call it sanitary waste receptacle. Let it be of a stable structure. If it's going to be plastic or going to be metal, let it be not perforated, not leaking, and let it have a cover, so much so that it is evacuated regularly to avoid spillage, which can attract rodents into your environment.
Okay, I have something here for you from Emmanuel Luxembourg. You know, well, we thank you for watching, Emmanuel. Please keep watching. And your email says, I want to know in practical terms how the public health officers ensure that the environment is safe for the people to live and carry out their daily activities. Because the last time I visited Nigeria, Lagos, I didn't feel the impact of these officers.
We'll just take a quick break and we'll come back here and answer your question.
Okay.